Hi there, John Farahmand from Balance Physical Therapy and Human Performance Center here. One of the questions we get very often is what's the difference between physical therapy and chiropractic care? Both are fantastic, both are necessary. However, physical therapy differs from chiropractic care in the sense that we focus on long-term mobility, strength, and biomechanical faults or movement faults of our patients. The classic manipulation, the things that give patients the little pop, the high velocity, low amplitude thrusts as we call them in physical therapy, those are necessary sometimes to get patients over a mobility hump and to free up sometimes entrapped neurological structures, etc. They reset what are called mechanoreceptor set points and help local tissue relax. However, that feeling can become addictive, and that's not something that we are fond of encouraging in physical therapy. We like to do a thorough biomechanical assessment, look at a patient's mobility deficits, strength deficits, and focus on the root cause of the problem. Do we do mobilization manipulation from time to time? Of course we do, but it's not the mainstay of our care as it is in chiropractic care. The gym behind me is an 8,000 square foot gymnasium designed and built specifically for helping with mobility and strength deficits for most of our patients. So both chiropractic and physical therapy have their place along the healthcare continuum. The difference mainly is that we are largely movement and exercise based. That's the difference. Hope that helps. Thank you.